Hi, this is Paul Wise and welcome to the Lawn Vets video series. In this short video I'll be sharing with you some tips on how to perform a procedure on your pet. To ensure the safety of you and your pet, I recommend, if you've not already done so, that you first watch our animal handling video. Okay, so we're going to have a little look at how we medicate dogs' ears, how we apply drops to them. Ear disease is a very common problem in dogs. See an awful lot of it. A lot of dogs with allergic skin disease, and sometimes the only thing that's actually demonstrably wrong with their skin is in fact their ear canal, but the underlying cause is allergy. So very important when we're medicating ears that we understand the anatomy of the dog's ear. So I've got a Wellington boot on the table. This is to kind of help you understand what your dog's ear looks like. If you can imagine, my hand is the flap, so that's the ear flap we got here. So that's the flap. We've got a vertical part which goes down the side of the face, and then we've got a bit that's horizontal that goes in, and the eardrum is way down there. Now in Dougie this is going to be underneath his skull, so it will be sighted a bit like that. So his eardrum's quite a long way away from the entrance, and people get quite upset and worried that they're going to poke things through dogs' eardrums. And in fact it's very unlikely that you'd actually manage to do that. Now if we've had a look at him and diagnosed he's got an ear problem, it's very important that we get to look at him before you start putting drops in yourself. If you fill his ear canal up with ear cleaner or something like that at home, and then you bring him in for me to examine him, the chances are the ear cleaner is going to obscure my view and make my diagnosis much more challenging. So I'd much rather see these cases. I prefer it if you don't treat at home first. If he's got a grass seed in there, for example, and you've obscured it with medication, we're going to make the wrong diagnosis. And the other factor with a lot of these ear medications, I need ID to determine that the eardrum is intact before we start to apply the medication to the ear, because this is not designed to go into the middle ear, which is the section beyond the eardrum. So the ear has, as I said, three parts: the flap, the vertical part, and this horizontal part. And dogs can get disease with any one of these parts, or possibly a combination of them. So sometimes we'll just see a dog that's got ear disease on the flap and the canals are okay. Sometimes we'll see a dog with disease of the vertical canal. Sometimes if they've been scratching out, they can make this area of the ear quite sore, and that does have some implications. But more often than not, the area of the ear we're trying to treat is this horizontal bit that's going in. So it's a deep structure right down inside. And for the drop to work, we've got to make sure we get the drop to where we need it to act. So in the presence of ear disease, we would literally just lift the ear flap up and drizzle medication on to the ear flap. I'm not actually going to do that in this case because obviously Dougie doesn't actually have an ear problem. If he had vertical canal disease, we'd gently, if possible, insert the nozzle into the ear. Sometimes you can't do that. If the vertical canal is too sore because he's put his foot in it scratching, you might not be able to do it. So sometimes you might just have to drizzle it on top of the ear like that and just let it run in. However, if you've got a horizontal canal problem, you've got to get it in a bit deeper. And I don't find allowing gravity taking it down, and I know a lot of videos out there where they suggest it will work. Personally, I don't find it very effective. So with a dog with horizontal ear canal disease, you want to be poking that bottle right inside. So it should actually just sit there if you poke it in far enough. Quite comfortably, it's not upsetting him. And then you would squeeze and drizzle the medication in at this point. So you're delivering the medication straight down to here. You're still some distance away from the eardrum, but you're getting the medication down to that horizontal canal, which is where we need it to go. And then it has the opportunity to do what it needs to do, solve the infection, get rid of the bacteria and get rid of the yeast, which are very common inhabitants of these ear canals. Key points is the application of the drop. As I said, you've got to get it to where you need to go. The other key point is you've got to carry on medicating until the condition has resolved. So I always recommend that you come back for checkups with the nurses. The nurse can have a look down the ears and make sure you're getting the drops where you need it to go to, and also to make sure you continue to treat for long enough. If you fail to get that drop down to where it needs to go to, or if you don't treat for long enough, it will not solve the problem. And then the ear disease appears to come back. In actual fact, it never actually went away, and people think the drop has failed to work and we chose the wrong drop. And that is not the case. That bottle of drops will work most of the time, and the only reason it fails to work is because we're not delivering the drop to where we need to for long enough. As always, if having watched this video you have any questions, or if you encounter any difficulties performing the procedure, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video will be very much appreciated.